Earlier this year, a well-known public figure with more than 175 million followers on the social media platform X, formerly known as Twitter, made waves with a social media post that said, "DEI is just another word for racism. Shame on anyone who uses it." Now, this caught my attention because DEI, or diversity, equity, and inclusion, has been a major part of my professional life. I spent 6 years as the Associate Dean of Diversity, Equity, and Inclusion at a medical school. So, if DEI is just another word for racism, did I spend 6 years of my career as the Associate Dean of Racism? I explored further, and this same social media figure said, DEI discriminates on the basis of race, gender, and many other factors, and that it was immoral and illegal. After noticing a significant increase in claims such as this one, I performed a basic internet search using the keyword DEI, and I found an abundance of testimonials that DEI was destructive and that it promotes division in our society. So if DEI is truly divisive, how dare I, an admitted fan of DEI, stand before you today speaking about a subject purported to cause divergence? My experience with DEI has been that it fosters unity. So where is the disconnect? My assertion to you today is that DEI has been presented in a way that has allowed for the concept to either be misunderstood or intentionally manipulated. Let's start with the D in DEI. Diversity is often portrayed as taking opportunities away from qualified individuals and just giving them to unqualified racial and ethnic minorities. The goal of creating diverse work environments aims to recruit and retain qualified applicants from all walks of life. Diverse hiring practices are not ways of just doing favors for unqualified racial and ethnic minorities or historically marginalized groups. They are ways of creating dynamic, top-shelf organizations. For example, in healthcare, an increase in the proportion of Black primary care physicians in an area is associated with decreased mortality for Black people living in those same communities. A population-based study of more than 3.5 million births showed that increased racial diversity in the nursing workforce was linked to a significant decrease in severe adverse birth outcomes, not just for Black, but for white, Hispanic, and Asian Pacific Islander patients. More than a dozen studies, including an empirical study of almost 4,000 hospitals, showed that racially diverse hospitals and some non-medical businesses were more efficient, more productive, and they performed better in terms of innovation and financial returns. Let's move on to the E in DEI, equity. And let's use the example of kidney disease. Using county health data reported in 2022, you will notice that in Chatham County, Georgia, where Savannah is located, the prevalence of diagnosed kidney disease is a little more than 3%. However, data from the National Kidney Foundation and from the U.S. Renal Data System's annual report revealed that approximately 14%, or 1 in 7 adults, was estimated to have chronic kidney disease, which we refer to as CKD. In addition, 90% of people with CKD are unaware of their diagnosis, as it does not usually cause symptoms until the end stages. So we know this estimated diagnosis of CKD in slightly more than 3% of our neighbors in the Savannah area. It's not accurate. The rates are probably 4 to 5 times higher. The biggest problem with this is that there is a myriad of interventions that are at our disposal that can slow the progression of CKD and lower the risk of death and serious morbidity. If someone doesn't even know they have kidney disease, then they will not have access to these interventions that can save their kidneys and their life. Equity in health, or health equity, is defined by researcher Dr. Paula Braveman as attainment of the highest level of health for all people. Equity is not promising equality, which would be everyone having the same outcome. It's just asking for an opportunity to achieve the best health possible for each person. Equity is helping to identify the 90% of people with kidney disease who do not realize they have a problem. Equity requires increasing access to high-quality health care for everyone so that those at risk for CKD can be tested. Equity also means getting rid of an outdated model of diagnosing kidney disease that causes Black patients to often find out they have a problem even later than everyone else, frequently when it's almost too late. You see, for years, we were told that Black people naturally have higher levels of creatinine, which is a marker for kidney disease, because Black people have more muscle mass. Imagine me, walking into a doctor's office next to Arnold Schwarzenegger. If I had a higher level of this marker for kidney disease compared to the Terminator, I might be told, oh, you don't have kidney disease, that's normal for you because you're black, and therefore you have more muscle mass than Arnold. Why y'all laughing? No? Exactly, right? Equity is what happened when researchers a few years ago finally started to question this dubious claim in response to DEI initiatives from across the country. A task force developed between the American Society of Nephrology and the National Kidney Foundation created a new way of estimating kidney function that more accurately identifies kidney disease in people of all races. Now Black people and everyone can be diagnosed on time and perhaps have access to some of these life-saving and kidney-saving treatments I mentioned earlier. Implementing this new type of testing universally is not divisive. It's an opportunity for better health outcomes for everyone. Now, some of you all might be saying, well, that all sounds great, but all these extra kidney tests and preventive treatments are going to be really expensive. Who's going to pay for that? Well, I'm here to tell you, we as a society are already paying for it. The Medicare program funded by us, the taxpayers, spends more than 24% of its funding on patients with kidney disease. Treatment of just the end stage of kidney disease alone accounts for 7% of all Medicare spending, even though this patient population only makes up 1% of all Medicare beneficiaries. You see, a lot of health equity interventions cost us money on the front end, but they save us a lot of money on the back end by preventing disease. More importantly, health equity saves life and improves the quality of life. So on to the I in DEI. If you look at certain communities, local communities, such as Dutch Island, they have relatively low rates of disability with a little more than 1 in 6 residents being affected. However, if we look just outside these walls, in this surrounding community, the rates of people living with at least one disability are more than 40%, or 2 in every 5 people being affected. People living with disabilities or different abilities are 4 times more likely to report being in poor or fair health. People living with developmental disabilities are often, they have a much lower life expectancy. They have a life expectancy that's 16 years lower for men and 18 years lower for women compared to the general population. People with disabilities are less likely to receive the basic preventive care recommended by organizations such as the U.S. Preventive Services Task Force. When disabled people have low vision, it's less likely to be detected in a timely manner. People living with sickle cell disease have disability rates as high as 69%, and they have a life expectancy 21 years lower than people living without this debilitating disease. So what does all this talk about disabilities have to do with the I in DEI? Inclusion means following recommendations of organizations such as the American Academy of Developmental Medicine and Dentistry, who recommend inclusion of people with neurodevelopmental disabilities into mainstream clinical trials. See, currently our medical algorithms and clinical decision-making tools are based on evidence and studies that excluded these populations. As a result, we are now more likely to miss certain diseases such as sepsis or infections in people living with disabilities. Inclusion means doing things like community health fairs, dental screenings, community dental screenings, immunization fairs, to increase access for people that have limited mobility or have difficulty with transportation or getting to a doctor's office. Inclusion means, for people that are unable to leave their home, for example, increasing access to telehealth services or home health services so that they're not excluded and so they'll have access to high-quality health care. Inclusion also means, in addition to access to healthcare services, increasing access to safe places to exercise. Think about locally, our community Tied to Town Trail. It's a beautiful urban loop about 30 miles around our beautiful city of Savannah. Interventions such as that will increase safe places to exercise for everyone, with disabilities or not. It's a way to create community well-being, right, and increase access to healthcare, to exercise, which can prevent a lot of things that cause kidney disease. These kind of interventions are not immoral or illegal, as some DEI detractors might say. DEI, diversity, equity, and inclusion. It's under attack for being allegedly divisive. DEI used appropriately can be a uniting force that brings us all together. DEI is paradoxically the perfect way to promote unity in our country. Some people who argue and detractors against DEI will say, well, DEI makes people feel shame because of past mistakes like kidney disease run amok, and they don't like feeling shame. Well, I'm here to tell you, I've got some exciting news. We have a way to undo the mistakes of the past. We have an opportunity to promote equity and ensure that millions of people in the future do not end up on dialysis. Diversity, equity, and inclusion save us money, and they make us more productive as a society. DEI will increase patient and customer satisfaction. It'll make our organizations, hospitals, more efficient, more productive, and more innovative. Beginning today, rethink what you might have heard about DEI. Let's look for ways to promote diversity, equity, and inclusion into all aspects of our personal and professional lives. The world will thank us later.